All right, let's get into it. You ever find yourself sitting in a doctor's office, listening to them and thinking they're speaking a completely different language? Well, guess what? They kind of are. But today, we're going to crack that code. We are talking about medical suffixes, those little word endings that are the secret key to understanding all those super complex terms.
I mean, you see a word like this, otorhinolaryngologist, and your brain just wants to throw in the towel, right? It looks impossible. But what if I told you that by the time we're done here, you'll be able to look at this word and so many others and just take it apart, piece by piece?
Because here is the big secret. Medical terms aren't some random password you have to memorize. No way. They're more like a puzzle, built from logical, interlocking pieces. And the most important piece, the one you always look for first, is the suffix. It's the bit at the very end of the word, and it tells you exactly what's going on. So first things first, let's tackle the suffixes that answer that big, scary question, what's wrong? These are the endings that tell you there's a problem, a disease, a condition, some bodily function that's gone a little haywire. This is the language of diagnosis. Think of these as little labels or signposts, so when you see something ending in osis, it's pointing to a general condition. If you spot a pathy, you know it's about a specific disease. And if you see penia, well, that just means there's not enough of something. Each one is a clue. Let's really zoom in on the rock star of this group, itis. Seriously, if you only learned one suffix today, make it this one. It just means inflammation. Simple as that. And you see it everywhere, from tonsillitis to dermatitis. It's a direct signal that something is irritated or infected.
And this is just a perfect example of how it all works. You take a root word, like arth, which means joint. You slap on our new favorite suffix, itis, for inflammation. And bam, you get arthritis, inflammation of the joints. See? It's not magic. It's just a formula.
And our little decoding toolkit just keeps getting bigger. A suffix like pina is your clue that we're talking about breathing. Something like raj or jia signals an excessive flow. Think of the word hemorrhage. Every single suffix you learn is just another puzzle piece clicking right into place.
Okay, so we figured out what the problem is, now what? Well, now we get to the fix. This next batch of suffixes is all about the actions, the tests, the procedures that doctors use to figure things out and, solve the problem.
These are what I call the action suffixes. An ectomy means they're taking something out. An otomy is a cut into something. And a scopy, that's a visual exam, usually with a tiny camera. They literally tell you what is being done to the body.
Now let's see how these pieces connect with a quick little story. This is where you really see the language in action, taking us from the diagnosis straight to the treatment, all described by these handy little suffixes.
And here it is. This is where it all comes together. So a patient has appendicitis. That's inflammation of the appendix. And what's the solution? An appendectomy, the surgical removal of that appendix. See how the problem, itis, leads directly to the fix, ectomy? The logic is just baked right into the words themselves. It's brilliant.
Okay, let's grab another one. How do doctors actually see what's happening inside you? Well, they often use a process that ends in graphy. That suffix just means the process of recording, kind of like taking a very fancy picture.
And the thing you get from that graphy process is a tomogram. So the process of tomography gives you a tomogram, the actual record, the picture the doctor looks at. One is the action of recording, and the other is the result. Simple as that.
All right, we've got the problems, we've got the procedures. Now let's look at the foundational pieces. These are the suffixes that work like the basic grammar of this whole new language.
Now, this is a really simple but super important difference. You see logy at the end of a word? That means the study of something. So cardiology is the study of the heart. Now, the person who actually does the studying, that's your ist, the cardiologist. One's the field, the other's the expert.
And then you have these guys, the adjective suffixes. These little endings like ak, ow, and ik just mean pertaining to or related to. So if you're talking about something to do with the heart, it's cardiac. Something about the kidney, that's renal. They just turn a thing into a description of that thing.
And hey, don't let those Latin-sounding endings scare you off. A lot of the time, suffixes like adium or us are just there to say we're talking about a structure, a thing, a part of the body. Like the pericardium, the structure that's around the heart. That's all it is. Okay, we've collected all the pieces of our puzzle, the problems, the procedures, the grammar. Now for the fun part. Let's put it all together into a simple 3-step method you can use anytime, anywhere.
Here it is, your 3-step plan to becoming a medical term detective. Step 1. Always start at the end. Find that suffix and figure out what it means. Is it a problem, an action, a person? Then, step 2, you just connect that meaning to the main part of the word, which is almost always the body part. That's it. That is the entire system.
So here's the biggest takeaway from all of this. Forget trying to memorize a medical dictionary. That's impossible and frankly a waste of time. What you need to do is learn the system. Once you understand the building blocks, the root words, and especially these powerful suffixes, you can break down almost any medical term you come across.
Remember where we started? Otorhinolaryngologist. Let's do it. Oto is ear, rhino is nose, laryngo is throat, and the suffix logist, the specialist. So, an otorhinolaryngologist is a specialist in the ear, nose, and throat. N-E-N-T. See? You did it. You unlocked it. Now the only question is, what word are you going to decode next?